I was never that great at running growing up. I did tend to have palpitations, like just going upstairs, and I always thought that was normal. That was just life. Oh, I went up some stairs and I can feel my heart beating in my chest pretty hard. I guess everyone just has this. I'm Clara, I'm 24, and I live in Mountain View, California. My entire adolescence growing up, I had this idea that I don't really like my chest. It's kind of weird. I don't really know why. I brought it up with my primary care physician and had x-rays, and yeah, I had Pectus Excavatum.
Pectus excavatum is the most common congenital chest wall abnormality. It is the one where your chest is sunken in, and it is about 80% of all chest wall deformities. So of all of them, it is far and away the most common. There are several reasons why somebody might seek out treatment for their Pectus excavatum. Exercise intolerance is the #1 symptom that people are going to complain of or come in with. So if the body has more demands, how can the heart try to keep up? There's only 2 ways to do so. One is by stretching a little bit, but the other way is to speed up. And so when the heart is compressed, then it loses its ability to stretch. And so you've taken one of only 2 compensatory mechanisms away. So now all it can do is speed up. So palpitations, rapid heart rate, another very frequent symptom. So as far as surgical treatments go, one is a NUS procedure or a modified NUS, minimally invasive approach, whereby you make incisions on the side of the chest rather than down the middle. So it's a little more cosmetically pleasing, if you will. And then you use a camera and those small incisions to get a bar placed safely behind the sternum, flip it up, and then secure it. And because the cartilages are left in place, that bar needs to stay in place for longer. So usually a minimum of 2 to 3 years for the bar to dwell. We also have our partners in radiology who do complex 3D reconstructions. We do 3D printing models. We also have partnerships with industry and product reps who can create customized solutions for patients. We have a whole landscape of tools to try to address each patient who has a unique situation.
Stanford has a very good reputation, so I felt of all the places that I could have this done, I just felt very comfortable with it. Any concern I had, they would answer my questions honestly, and it just felt very comforting. Yeah, I think I'm just completely normal now. I have been trying to get into running recently. I feel like I'm making good progress and being able to go farther, get a little faster. I can walk upstairs without feeling my heart beat in my chest. I do feel like I can breathe deeper. Yeah, just all the little things.